All right, let's talk about Monday. Samantha, one of our med students, wrote this blog for all of you, and it's great because we kind of like coming out of September. Sometimes it's a little challenging with all the information we packed in for the month for Aortic Disease Awareness Month. Where do we begin again when it comes time to talking about our blogs? And somehow they made the decision, let's go through some of the medications that we take. Let's take a couple weeks and really delve into them. And I often find posts from people talking about side effects, talking about medications that they're prescribed, and gosh, sounding like they're this close to wanting to just make a decision to stop taking meds altogether. And it's so scary when I read these things. So let's kind of take a minute and really learn about beta blockers, and let's understand why is a beta blocker even important? And then we're going to get into what they are and what they do. So as we know, the aorta is responsible for transporting all of that oxygen-rich blood from your heart to the rest of your whole body. And in patients with aortic disease, such as an aortic aneurysm or a dissection, the walls of the aorta can become weakened or damaged. And if it's left untreated, this can lead to dangerous events like an aortic rupture, and that can be fatal. Okay, so beta blockers are commonly prescribed for heart-related conditions. They are one of the first-line treatments for patients that have aortic disease, and their primary role is actually to reduce the stress on the aorta, and it slows down the heart rate, and thus it lowers the blood pressure. So that's the easiest explanation of a beta blocker, and this is really crucial for people that might have a faster heart rate and higher blood pressure, because those can increase the force that is exerted on the already weakened walls of the aorta, which raises your risk for a rupture or dissection or further damage. So that's kind of like the major summary. We could probably hard stop right there, but we're not going to. The way that beta blockers work, and I am not a physician, and I want to preface, I'm reading information also not written by a physician, but a medical student who did all of the research that was necessary to provide this for you today. But it's really interesting because beta blockers actually work by blocking adrenaline or epinephrine. And I think we've all heard of epinephrine. And these are chemicals that affect the heart. And so when the action of adrenaline is dampened or lessened, the heart actually beats slower, and therefore it's with less force, which results in a lower blood pressure. And these are all good things when necessary, because not everybody with aortic disease actually has to have to take a beta blocker. Not everybody does, but those that do, when you reduce the workload on your heart, your beta blocker actually helps minimize the stress on the aorta by preventing it from expanding or tearing. It can help do that. And for patients with conditions like an aortic aneurysm or a dissection, for instance, the lower blood pressure that is induced by a beta blocker reduces the risk of these conditions worsening. But for people with Marfan syndrome, which is a genetic disorder that actually affects the connective tissue and increases the likelihood of developing aortic aneurysms, beta blockers are often prescribed to prevent the aorta from actually dilating. So a little bit of a different nuance whether you have a CTD or not. There's several types of beta blockers. So for those of you that are prescribed metoprolol or labetalol, there's so many others. There's many types, and unlike some medications, they can be the effects can be nuanced and different depending upon which drug you take. It might be in the same classification, generally do the same thing, but there's still going to be some differences. So the most commonly prescribed beta blockers for aortic disease would be metoprolol, which we've heard of, atenolol, propranolol. And you'll know a beta blocker because they are the lols. They end in LOL. I'm on nebivolol. There is labetalol. When you go to the hospital, they typically will give you labetalol, especially if you're on metoprolol. So just know that if it ends in LOL, it's probably a beta blocker. These medications are actually chosen because of their ability to provide consistent and constant control of blood pressure and reducing the heart rate over time. Now, for patients with aortic disease, beta blockers are probably going to be a long-term commitment. They're not typically just for short term. And I think a lot of patients think that when they've gone on beta blockers and all of their levels of their heart rate or blood pressure are low, they think, oh, well, I'm doing good. I'm just going to stop. But you can't, because the reason you're doing good is because you're on the medication. There are probably cases where if you've lost like 30, 40 pounds and you've been working out, that maybe things could be reduced, your medications, but I would venture to say they're still going to want to keep you on that beta blocker. Although it's between you and your physician, there's so many different reasons why you could be unprescribed, basically. But this medication actually does more than just stabilize your condition. It also helps the need for overall surgery. It kind of reduces the chances of an intervention. It doesn't eliminate it. Everybody is different, but it could potentially reduce the need for medical intervention. Again, alongside lifestyle changes and modifications like maintaining a healthy diet and avoiding strenuous activities that can increase your blood pressure. Beta blockers form a cornerstone of aortic disease management. Okay, all of this is described here in this graphic. It's a vital medication for many aortic disease patients, and by reducing heart rate and blood pressure, they kind of help alleviate the stress that's placed on the aorta, further preventing damage or rupture potential. But those living with this condition, beta blockers can actually mean a sense of protection, and they're an essential part of long-term care. So if you or your loved one have been prescribed a beta blocker for aortic disease, it's really important to take them as directed and attend regular checkups to monitor your condition. Because beta blockers, unlike a Tylenol, don't necessarily work after 20 minutes, from taking them. Sometimes they could take 2 hours, depending on the medication. It could take longer. You have to take your medication at the time or time frame that you've been prescribed. And you've been prescribed this for a specific reason based upon when you're experiencing the spikes in blood pressure or increase in heart rate. So again, if you took it at 8 a.m., might not really take effect till 10. This is really a very important conversation that you should have with your cardiologist or with your surgeon, whoever is, or primary care, whoever's making these types of healthcare choices and decisions. I know there are people who have alarms set and they are there to take that blood pressure pill the exact same time every day. I'm more of a take it in the morning, take it at night. So I have a little bit of leeway. I don't believe in setting my alarm to wake myself up for medication if I know I'm going to wake up within an hour. Like if I'm waking up between 8 and 9, I'll take it in that time frame. I don't set my alarm because sometimes I don't go to bed till late. So I feel that sleep is essential for me. That's a decision that I made with my own physician. So you kind of have to have those conversations. This is all part of acing your healthcare journey, right? We've talked about that. And I'm going to refer back to that from now till the end of time. This is part of advocating for yourself and speaking up and communicating with your team and educating them about the lifestyle that works best for you to be the most compliant. So consult your healthcare provider so that you can understand and they can understand and determine the best treatment plan for your specific need. So this was Medical Monday. This was all about medication beta blocker. And we do get into something else when we move on to Topic Tuesday. But I just wanted to say, I hope you got something out of this for your Medical Monday.